Next, we move to Marion Winkler, PhD and RD, who will be discussing the quality of life of home parenteral nutrition consumers. Dr. Winkler is a professor of surgery at Brown University Alpert School of Medicine and a surgical nutrition specialist in the Department of Surgery and Nutritional Support Service at Rhode Island Hospital in Providence, Rhode Island. Dr. Winkler, thank you so much for sharing with us today on this extremely important topic.
Thank you. I'm delighted to be here. Let me just bring up my slides. And I want to tell you that I'm sitting in a very cold office, so I hope I don't shake while I speak. Let's see, why is this not? Oh, can you see this in just the slides, or is it just showing up in?
We see disclosures. We see disclosures right now.
Okay, but you don't see the little boxes on the side. You just see
yes, we do. If you
you know, I have two screens here, so that is the problem. Let me see how I do this. I am sorry about that. I have it in slideshow, but
you may need to stop your share and share the other PowerPoint image.
Okay. Aha, you got it. No, still not working.
Nope, this is good.
Oh, you see it now?
Yeah, it's right now. You just have to.
Perfect. Okay. All right. So I am going to speak about quality of life and intestinal failure this afternoon. And first, I want to thank SWAPNA. And many of you know that I have been studying quality of life for most of my career and researching quality of life for most of my career. But where I have gained the most knowledge is from interacting with all of you. And I've been blessed really to have gotten to know SWAPNA and many other patient and family advocates over the last couple of years in some of the work we've been collaborating. So hopefully I'll share some of that as well. But today specifically, I plan to speak about a home parenteral nutrition patient-reported outcome questionnaire that you and your clinicians can use to start a conversation about quality of life. And I spoke about starting this conversation on the last 2 days of the conference. So I'm going to try not to repeat the same information, but I refer those of you who didn't have a chance to see that presentation to perhaps view that as well. And I also want to share how we plan to use this questionnaire in the Lift Echo outcome study, research study that SWAPNA just introduced to you and that Dr. Iyer will also speak about. Okay, so let me first talk about what are patient-reported outcomes, PROs. And I want to make sure the slide is moving, yes?
No.
No. I am so sorry. We
It's
should
okay.
have tried
We're
this.
on your disclosure slide still.
Yeah, I see that. There we go. How's that?
Yep.
Okay, great. Thank you. Sorry. Patient-reported outcomes are basically information that patients believe is important about their health. And in the published literature and in many outcome measure tools, these tend to address things like pain, sleep, sexual function, gastrointestinal symptoms, psychosocial impact, and social support. But really, it can be what matters most to you. And a lot of different questionnaires are being developed to be used in healthcare, again, to address these topics and stimulate conversation. Very, very frequently, patient-reported outcomes include health-related quality of life. Oftentimes, they address patient satisfaction with treatment, compliance with medical regimens, and end results of healthcare interventions. And examples of that might be pertinent would be changes in weight, blood pressure, laboratory tests, just to name a couple of different healthcare outcomes that we're oftentimes interested in. My interest in patient-reported outcomes and embracing quality of life for intestinal failure and home parenteral nutrition really is about improving clinician and patient communication and further advocating for shared decision-making. So that's really the standpoint for which I come into this. So let's start by talking about quality of life and HPN. And I spoke the other day that there are many definitions of quality of life, and everybody really should think about your own personal description of quality of life, but they tend to center on enjoyment of life, being happy and satisfied with life. In my research of adults living on home parenteral nutrition, the majority of whom have intestinal failure, short bowel syndrome, and some with dysmotility or pseudo obstruction. I began this journey of researching by doing what are called semi-structured interviews with individuals. And this is qualitative research, very patient focused. And what I asked were basically open-ended questions. And then I looked at all of the different responses, and I did this on telephone. So I had audio tape recordings. And then I listened across all of the interviews and tried to capture the themes that were similar and perspectives that may have been different. And so what I'm going to share is just some of the themes that arose from this interview type of work. But basically, in this population, quality of life was defined as how much one enjoys life, being happy and satisfied with life. And it was very much associated with being able to do what I want to do when I want to do it. And the things that people wanted to be able to do were to go to work, go to school, do household chores, attend church or other types of social functions, play or participate in sports and other leisure activities, travel, and eat and dine in restaurants. And the factors that influenced how much one enjoyed life and being happy and satisfied life with a positive flavor to it was having good health, having strength and stamina, having strong faith, family support, and financial security. And some of the negative factors were being in pain, feeling fatigued, having disabling and disastrous diarrhea, or ileostomy or ostomy leakage and high outputs. And many of these factors influencing quality of life for this work, I could group into categories. So as I mentioned, there were a number of factors around food and eating. And these spanned from eating to survive, to eating to stimulate health and immune system and intestinal adaptation, or learning to eat just for comfort or pleasure, or being in a social situation around food. And there was a whole range of how these factors influence quality of life positively or negatively. The gastrointestinal symptoms here play a huge role in the lives of people living with intestinal failure. There was also some very interesting findings regarding the HPN infusion schedule. And what I was able to hear in these interviews and capture was that there was groups of people who felt very structured, where their infusion schedule really dictated life, and they would tend to plan everything around the time frame they had to do their infusions. That would include maybe not going out at all, or cutting an evening short and running home, never really doing any adjustment of times or skipping. And then there was a group of people that I called flexible, that really learned to put their life first and their infusions fit into their life. And so they had a lot more flexibility in their start and stop times, and were more interested in taking it out with them and going on vacation. And we also know from recent published literature that the parenteral volume, either IV fluid and or parenteral nutrition, is associated with quality of life, both in terms of the number of days or nights of infusion, and starting to see a lot of that is based on the volume of the solution. So as volumes go down, or number of days or nights go down, quality of life goes up. So this is a whole interesting area of research being done now. Certainly, there was a lot about psychosocial functioning, mental health, and coping skills. And I found a lot of association around the topic of feeling prepared, well-trained, educated, and confident in being able to do the procedures that needed to be done. So these were the primary factors influencing quality of life. So what is the Home Parenteral Nutrition Patient-Reported Outcome Questionnaire? Well, this is a clinically relevant approach to identify and address lifestyle concerns of home parenteral nutrition patients that can be used in the medical office, or during a home care visit, or even in a telemedicine type of situation. It's different from a lot of questionnaires and quality of life tools because it does not compute a score that's used to compare to healthy populations or others, or yourself over time. It really is very subjective or qualitative in its approach. And we designed this to be a conversation starter. So it's like a self-assessment, and it helps prioritize important lifestyle issues that can be discussed with the physician or clinician. And in the research that we've conducted, we've done a lot of validation work among individuals who are on home parenteral nutrition, also with clinicians, physicians, dietitians, nurse pharmacists, and patient advocates in terms of the relevancy and importance of the items on the questionnaire. And then we administered the questionnaire to do some validation work in collaboration with Dr. Charlene Comfort at the Hospital of the University of Pennsylvania, in which we were able to demonstrate that this tool was sensitive to differences among individuals who had chronic intestinal failure or acute intestinal failure. And this does, we believe, improve clinician-patient relationship, another factor I really want to study, because a patient can share how he or she is feeling and obtain immediate feedback. And so it does lend itself to providing a positive patient experience. So what's in it? Well, again, the content or the questions I'm going to show you are structured around the HPN infusion schedule, around education and training preparedness. It includes some questions about or reflections about GI symptoms. There's a section on psychosocial function and coping, and the impact of illness and therapy on quality of life, plus a rating of quality of life, a self reflection on how you would rate quality of life. Now, this is a small slide on your screens. I'll give you a, it's posted, this questionnaire is posted on the Oley website, and I've included the link, but you can find it also on the website. And I'm certainly happy to provide it if somebody wants it. I'm going to show it to you broken down so you can actually see the items on it a little bit bigger. But the instructions are that the questionnaire is intended to help you identify areas of concern or problems with living with home parenteral nutrition over the last 2-week period that may affect quality of life or your ability to do the things you would like to do. And that these patient-reported outcomes can be used, as I said, to prioritize what you would like to discuss with your physician or home nutrition support care team during your visit. So what I'm going to show you now are the results of the study we conducted with Dr. Charlene Comfer at the university, the Penn Home PN program. And these were 77 individuals with acute or chronic intestinal failure. So the first part is the importance of having one or more nights without HPN or having a shorter HPN infusion and being able to do what I want to do when I want to do it. And you can see that the rating scale is on a Likert scale, basically from not important to extremely important. And for this group of participants in this study, the majority really felt that these were very or extremely important. Now, I'll tell you is that we use this questionnaire in our practice. And I find a lot of times that patients that I work with don't even know. They're surprised when they read this question. They say, you mean I can have one or more nights off PN, or I can have a shorter HPN infusion schedule? And while this may not be appropriate for every single patient, and it may not even be possible, it is a conversation starter. And this is a really important conversation for people to have. We learn more about the life, and patients learn more about the practice or the areas that we take into account to help plan the infusion schedule. So this has really been an interesting dynamic. The second section here is all on training and preparedness for HPN care. And again, in this particular study, there was very strong agreement that people felt that they were well trained and prepared to do self-care for their PN therapy. They understood their need for being on parenteral nutrition, how to care for their line, the signs and symptoms of infection and dehydration, and what to eat and or what not to eat, who to call. They felt supported. And they felt very confident in there was an association with their training and their training and preparedness with their confidence in their own ability. So that was not surprising in that program because they have such a strong home PN program. In our practice, interestingly, I find a lot of times that people reflect that they don't really understand the signs and symptoms or some of the answers to these questions. And so it's an opportunity for us when we're reviewing this form and having the conversation to do more training, to do more education, to get more resources, to recertify in techniques and procedures. Again, a really good opportunity to address these things. And what I'm always worried about is the awareness of individuals in terms of groups like Oley or the Gutsy Perspective or Transplant Unwrapped or all the wonderful resources that are out there. So this is another opportunity to be able to introduce those resources. And there's much more variability in how well people agree or don't agree that they're aware of these organizations. Okay, the next section really addresses health issues. So about health limitations on what I want to do in my life, about sleep disruption or sleep due to the pump or due to urination. And Dr. Hassan Dashti addressed this the other day in his research presentation about the sleep studies and has used this questionnaire in some of his work, or at least some of these questions. And it also addresses how the diarrhea or the ostomy output interrupts life. And you see in the responses here much greater variation in responses because everybody is so individual. Their anatomy is different. Their disease state or health of their GI tract is different. How they are infusing and other health issues all may play a role in, and not necessarily that we'll see everybody having similar responses. And these responses may change over time and be very different by what you're experiencing. So using this tool to have a conversation over time at different encounters or different visits really is very helpful as well. Similarly, the challenge of coping with being on home parenteral nutrition has a lot of variation in response. And the support that people feel, feeling supported by their home care team, that tends to be strong in this patient population, and it may be different, and it may be an opportunity to have a conversation about what programs are out there, or what needs need to be met, resources, referrals, etc. And finally, there are 3 quality of life questions. So the first 2, and these quality of life questions, I might add, come from the quality of life questionnaire that's been used in some of the research studies and in a lot of publications that Dr. Janet Baxter in the UK developed. It's called the HPN-PROQ, and it was the first therapy-specific questionnaire designed for this patient population. And it was modified as the short bowel syndrome quality of life questionnaire and used in a lot of the GLP-2 studies. So with permission, these 3 questions are included on our HPN patient-reported outcome questionnaire. And so these first 2 talk about the degree that quality of life's been affected by the underlying illness or by the HPN therapy. And I want to say that this was intentional to not tell us the direction. So when you answer this question, you're talking about the effect. If quality of life has had a major effect, a moderate effect, no effect, a neutral effect on life. And so I always have to have a conversation with people when they fill this out to understand whether that effect is positive or negative. And so that is another opportunity to have this conversation and to really get a sense and understand how someone's feeling. And then finally, there's one question about how is your quality of life? And you can see the scale is poor, fair, good, very good, or excellent. And again, this people answer all over the board, and this changes, and it starts the conversation about, well, what factors are playing into this description of poor or fair quality of life versus good, very good, or excellent. And in this group, it was about 50-50 how the ratings were. So we did a lot of interviews around people using these questionnaires, both when it was being developed and after the fact. And here are just 2 representative quotes of what people felt. And I just read them off to you. One is, I think these questions are phenomenal. I think they nail it. Doctors don't ask these questions, but this feels so human and full of empathy. I really appreciate these kinds of questions. And the second, I think it's excellent. It gives somebody topics to focus on when you're at the doctor and you have many questions to ask, and then you go home and you remember you forgot to ask. So I think it's a great conversation starter to have patients fill it out and discuss it during the visit. So I want to just now shift into research that's using the HPN-PROQ. And I want to qualify this by saying that the intent of the questionnaire was to be a clinical tool, not a research tool. But the questions certainly can be used in research studies, and we could look at the percentage of time that people answer the question one way or the other. So the first study that is being done that I'm aware of is one that we're doing that's been on pause during the pandemic, but this is basically just an observational study where we're using this in practice. And I have people who are trained to be observers. And we've done a few, so it's kind of like a pilot study, I guess you could say. This is qualitative in nature. And so the observer just really captures what they're hearing, what they're seeing, what the nonverbal communication is. And in the little pilot study we've done, we see more equal amount of time in speaking, like the physician and the patient are talking, and not dominated by the medical professional, which sometimes is the case in a regular office visit. We also see more touchy-feely kind of topics getting discussed, at least that's what I kind of talk about, rather than just, you know, lab tests and weight and you know, medical things. So this may be very interesting, and our interest here is understanding whether this does improve patient-clinician communication. The second I already mentioned was Dr. Hassan Dashti is using some aspects of these, the questionnaire in his research surveying home parenteral and enteral nutrition infusion times and sleep patterns. And finally, our plans are to use this in the research study that Swapna briefly mentioned and that Dr. Iyer will probably tell you about, the LIFT Echo patient outcomes and patient reported quality of life. So what our intent here is to demonstrate improved clinical outcomes and chronic intestinal failure and parenteral nutrition specific patient reported quality of life by providing virtual multidisciplinary support to the physicians through LIFT Echo. And Swapna has told you briefly about LIFT Echo, the Learn Intestinal Failure Tele-Echo Clinic. This is an online community of medical professionals dedicated to supporting the treatment and management of intestinal failure. So these clinics really are twofold. There are practitioners presenting case studies of patients they're really taking care of, where they can get consultation with experts both throughout the United States and really all over the world. We have a big global and international presence. They can get treatment guidance. They can ask very specific questions and get guidance about that. Oftentimes there's treatment alternatives raised or discussed. And through this, there's education being provided to physicians and really the full multidisciplinary healthcare team. And always included, in addition to these case presentations, are very small 15-20 minute didactic or educational topics that are being presented. So I'm almost done, and I just want to tell you really what the question is here. The research question we're interested in is, does physician participation in this LIFT Echo improve physician learning? In other words, do they improve their knowledge about intestinal failure management? And the intent is really to try to capture or provide an education to physicians who may not be immersed in taking care of intestinal failure patients. Maybe they have one or two patients and could really benefit from this expert group providing support. So we can easily measure using pre and post testing and see if knowledge changes. But what's very exciting is whether there are changes in how the patient is cared for as a result of this education. So we want to know whether the patient clinical outcomes and patient reported quality of life improves as a result of this physician learning. So the design is going to be where we'll have an opportunity to match patients to their physicians. the patients who are in this study will have an opportunity to share baseline demographic and clinical information. They would actually complete this patient-reported outcome questionnaire electronically or by phone several times during the study period. And there's also an opportunity to look at changes of an intestinal failure disease activity index that we're in the process of developing and validating. So how do you get involved? You can use this questionnaire. I've provided a link of how you can find it on the Oley website. And you can watch for announcements about Lift Echo research study. And I'm sure Dr. Iyer will address that as well. And I want to just close with a reminder that, as Swapna said, speak up. Your voice is very important. And the areas regarding quality of life that are important to discuss with all members of your healthcare team, I believe, are your personal definition of quality of life and what factors influence it, your goals and expectations of your therapy, your expectations around food and eating, any difficulty that you have coping with your medical condition, health, or treatment, and really anything interfering with your ability to do what you want to do. Thank you.